My name is Calliope. I'm going to be performing your exam today. And what we've got going on here are some tests like looking at different muscles in your head, your lymph nodes, your thyroid. We'll be testing some cranial nerves as well. We'll be looking at your eyes, ears, nose, mouth, and throat, as well as inspecting and testing the neck. Is that okay with you? Okay, I'd love to start by looking at the temporalis muscle in your head. So the temporalis, if you clench your teeth, you can feel the muscle jump a bit right in here, but it goes farther than just right in here. So I'll be taking a look right here and here. And then we'll look at your scalp. So I'm just going to get under the hair a bit and palpate around just when it's disengaged for a moment. And then if I could have you just clench your jaw and unclench, clench, unclench. Okay, so we'll be back in a moment to look at the masseter as well. But for now, I want to just look at your scalp, kind of moving from front to back a bit here. So, looking at the hairline and following that back around the ear and along here, back around. Feeling the contour of the skulls. Contours of the skull, rather. And just, if I could, look at the scalp. Just checking for infestations and lesions, areas of injury or dryness, oiliness, alopecia perhaps. Just checking here at the back, looking on one side and then the other. Good. Okay, let's check on the masseter now. So your temporalis and masseter muscles here are two big muscles of mastication or chewing. They are your superficial muscles here, but you've got a couple more called the pterygoids that are underneath. So while you're relaxed here, I'm just going to feel around here, and then we'll check the temporomandibular joint as well. Just feeling around a little bit here. And then if I could have you clench the jaw and unclench. unclench. Good. So let's check on this TMJ here. Do you have any sort of pain in your jaw? Any tightness? Okay. Any dysfunction with moving or opening the jaw? Any clicking? Okay. So while I'm holding the joint, I'm going to have you open and close and move the jaw around. So right here, if I could have you open your jaw, close, open, close. Okay, move your jaw to the side and the other side, side and the other side, back to neutral. Okay, no clicking or anything like that. So we're going to work from the back of the head and work forward and down. So we're going to take a peek at your lymph nodes. So right underneath the hairline here. Good. And post-auricular nodes. Pre-auricular. Okay. Parotid gland. Jugulogastric. Submandibular. Submental. Then along the neck here we have a superficial cervical. Posterior cervical. Back behind the SCM here. And the deep cervical chain. Good. And then supraclavicular. Good. Okay. If I could have you just turn your head so we can just look at this big cord of muscle. This is the SCM, the sternocleidomastoid. Attaches up in here, we have the clavicle as well. Okay, just turn. And any pain as I'm touching this? Okay, and if you could turn your head to the other side. Good. Okay, no pain? Good, all right. I'm going to just look at your thyroid here and then we'll come back up to your face. So I'm going to palpate around the lobes, and in the middle you have the isthmus. Good, and if I could just have you take a swallow, and I'm going to just see what I feel here in the thyroid, like so. Good, okay. Let's jot some notes down here. Okay. So for your face, I'd like to look at the skin and just feel the texture of the skin. And you're reddening up a little little bit as I'm touching you. Does your skin tend to be pretty reactive? With you there. When I wash my face or even just try to put on makeup, bright red. Bright red. Good. Okay, and we are indeed symmetrical. Everything is level, no signs of palsy at all. Good. Okay. Excellent. So let's go ahead and test the sensation here. So I have a little pointed tip here on the end of my reflex hammer. It is not sharp, but it's going to serve as our sharp sensation, okay? I'm just going to test this on your jaw here. All right, that was fine. Okay, I want you to close your eyes and just tell me when you feel the sharp sensation. Okay. Good. Mm-hmm. Good. Mm-hmm. Yes. Mm-hmm. Good. Uh-huh. Yep. Mm-hmm. Good. Excellent. So, sensation, and therefore the sensory aspect of cranial nerve 5, the trigeminal nerve, is intact. So now we want to assess cranial nerve number 7. This is the facial nerve, and it controls the muscles in your face that are responsible for expression. So if I could have you smile real big, good, and puff out your cheeks. Can you wrinkle your nose? Good. Close your eyes real tight. Open them real wide. And raise and lower your eyebrows. Very good. Okay. So let's look at your sinuses now. What I'm going to do is I'm going to press around here. I'm not putting any pressure just yet. But you just let me know if you experience any pain or tenderness, okay? Alright, let's start right here at the frontal sinuses. Anything here? Okay, and one side of the ethmoid. Other side. And the maxillary. Okay, other side of the maxillary. Okay, now I'm going to get in with some direct percussion, which is a bit of an accentuation maneuver in that if your sinuses aren't sore with pressure, they might be with direct tapping, all right? Let me know. Good. Excellent. So let's grab our pen light here and let's have a little inspection of your eyes. So I'm going to hold this up just below the eyes so I can look at them without shining this bright light directly in your eyes. So we have intact eyebrows and eyelashes. We have pale pink, moist lacrimal glands and white-gray sclerae, pretty irises, and round pupils. Good. And I'm just going to look at the conjunctival tissue here, if I could have you look up. Good. Look down. Down. Good. I'm going to have you look up again. And look down. Good. Now, here's a question for you. How do you roll your eyes? If someone asks you to roll your eyes, what do? Do you look up and away, or do you actually roll your eyes? I'm one of those people that takes it literally, and my mama always said that I would roll my entire head. I got in trouble for rolling my eyes all the time, and I would get so confused because I was looking up because I was thinking. Okay, we're just going to palpate the orbit here. Any pain or tenderness here? Good, okay. I am going to have you look right here. We're going to dilate your eyes a bit. Okay, and just keep looking right there. Good. Good. Okay, and if you could look right here for me. Give you a moment for your eyes to dilate, okay? Good. One more time. Good. Okay, if I could just have you look right here for me. Okay, I'm going to shine the light in one eye. And good. Constriction on the other side. Good. And the other eye here. Constricts in the other one. Okay, consensual response. And direct. Consensual. Direct. Consensual. Direct. And consensual. Excellent. So, I am going to have you look right here again. Dilate the eyes. Okay, look at my finger and follow it as it comes all the way in here. Good. Okay, so pupils are equal, round, reactive to light, and accommodate. Excellent. So I'm going to have you follow my fingers here using only your eyes without moving your head. We're going to test your extraocular movements. So we're just going to come up, down, up, down, side, 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 side. Okay, diagonally of the eyes there can move in all 6 cardinal directions of gaze. Let's take a peek at your ears now. So I'd like to just have a bit of a look here. Okay. And just let me know if there's any pain or tenderness. Anything here? Okay. What about right here? Any pain or tenderness? Good, okay. I'll grab our otoscope. Nope. There we are, that's what we need. Okay, so I'm going to pull up and back on your ear. And we're just going to have a little peek here. So, looking for injury, illness, looking for compaction here, blockage, erythema, checking out the tympanic membrane. And the other side here, back here. Okay, so we've got a transparent, pearly gray tympanic membrane, no bulging, perforation. Your canal is clear and non-red or tender. Signs of irritation, infection. Good. No drainage. Okay. Have you been experiencing any difficulty with your sense of hearing at all? Okay, we're going to do just a very simple hearing test here, in which I'm going to use this 512 hertz tuning fork to test your hearing. We're going to just tap the tuning fork. I'm going to have you tell me whether you hear it on the left side or the right side. Left or right? Good. Mhm. Yes. Good. Mhm. Excellent. So cranial nerve 8, the vestibulocochlear nerve is intact. Let's just jot that down real quick. let's check out your nose. So, I'm going to take the speculum off our otoscope and get rid of it. And I'm going to gently palpate around the nose. So we did our ethmoid sinuses. I'm going to feel around each nair. Any pain or tenderness? Okay, underneath the nose, the glabella, bridge of the nose, all the way down to the tip of the nose. All good? Okay, let's take a peek inside. So I'm going to have you tip your head back a bit. There you go. So we have a midline septum. No perforation inside septum. Nasal passages are clear. Not seeing any signs of polyps. Turbinates look good. No postnasal drip here. No drainage. Looks good, so you can bring your head back down. We're going to test cranial nerve number 1, the olfactory nerve. So, let's get this open. I am going to hold up something that has a scent to it. I'd like you to tell me what you smell. Cinnamon, good. This one. What does this smell like? Lemon. I'm gonna have you just smell this one side here. Vanilla. And this side here. Mint. Excellent. Just put that right over there. Okay. Now I'm going to occlude one side and then the other. I'm going to have you take some breaths. We can make sure there isn't any issue there. I could have you take a deep breath in through the nose and out through the nose, in through the nose, out through the nose, in through the nose, out through the nose. Shut that down before we move on to the mouth and throat here. Get our tongue depressor here and our flashlight, and we're going to take a look at your mouth and throat. So I'm going to look at the lips here. They are pink, and if I could have you open them a little so I can look at the sides here, the corners. Good, and if you could open your mouth. And we've got quite a few things to look for. So, let's look at the lower lip. Okay, good. The upper lip. Look at the side of the cheek here. Salivary glands there. Good. Other side here. Okay. Can you lift your tongue to the roof of your mouth? No central cyanosis. Floor of the mouth looks just fine. And you can lower the tongue. I'm just going to check on the teeth. No caries here. Okay, and as for the oropharynx here, let's look. The hard palate. Soft palate. Okay, and the arching in here. And then if I could have you stick out your tongue. Okay, we're just going to put that down there. Uvula's right in the middle. Can I have you say ah? Good movement there. And the pharyngeal wall. You have your tonsils out by any chance? Okay. No cobblestoning, the wall's smooth, no redness or irritation there. Okay, so I am going to do something that's not very polite. I'm going to have you open your mouth and I'm going to elicit your gag reflex, okay? Okay, it'll be real quick, so if I could have you open your mouth. And yeah, not fun. Not fun, but that's done. So I'm going to have you take another dry swallow. This time we're looking for dysphagia. So if I could have you just... Good. Did you feel any restriction? Was there any difficulty? Any pain? No. Okay. So, your voice is not hoarse, so that's one of our vagus nerve tests, and we checked out our glossopharyngeal, so cranial nerves 9 and 10 are intact. Now it's time to look at number 12. If I could have you stick your tongue out. Good. And move it up, down, side, the other side. Okay. And you can put your tongue back into your mouth there. So. We had our intraoral mini exam there. Okay. Lastly, we have the neck. So, we're going to test cranial nerve number 11, the accessory nerve, spinal accessory. We're going to do this in a couple ways. So, I'm going to put my hand on your head, and I want you to turn against it. Put my hand on your head, turn against it. Okay? I'm going to put my fingers right here. I could have you. Good. The other side. Turn. Good. And now, a few shrugs. A very easy way to test cranial nerve 11. Can you keep your shoulders hitched high? And then can you pull them real low? Okay, excellent. So, let's just finally reach for this bad boy, huh? At the very end here, I am going to listen to your carotid artery. We are going to listen not with the diaphragm here, this is for higher pitch sounds, but instead the bell here, which is for lower pitch sounds. So we're going to listen for a sort of swishing sound. This is called a bruit, and it's an audible heart murmur. So I'm going to just put the bell here. I'm going to have you take a deep breath in and just hold that for a moment. And exhale. Okay. The other side here. Deep breath in. Hold. Since there were no bruits, it is safe for me to palpate the carotid artery, and I'm going to do that just one side at a time. So, we're going to feel the strength and rhythm here. Good, the other side. Excellent. And so that was a +2 strength pulse. And I want to just feel the temporal pulses here. Let's feel. And those are also a +2. Very last thing I want to do is just check your general head range of movement. I'm going to have you move your head up and down, like so. Good. And to the side, to the other side, like so. Good. And a lateral tilt. So trying to bring your ear to your shoulder and back and forth. Back and forth. Okay, and you can stop that. Was there any movement issues there? Any restriction? Any pain? No. Okay, so then we need to do some notes here. We need to do some notes. So let's just review what we've got going on here. So we checked out your scalp, the muscles, mastication here, lymph nodes, thyroid. The face, checked cranial nerves 5 and 7, looked at the sinuses. We checked cranial nerves 2, 3, 4, and 6. Did our little inspection there. 8, did cranial nerve 1, 9, 10, 12, and 11. Did our little breathing test. Okay. Well, everything looks great. So, do you have any questions at all? So absolutely nothing out of the ordinary. All cranial nerves are intact, and all of your inspections were normal. Breathing is just fine. Bruise, lymph nodes, all of that. All good, okay? So I'm just going to sign off here real quick. There we are. I'd like to thank you so much for coming into my office today for this head, face, and neck examination. I hope you have a whale of a day and a good rest of your night. Thank you.